I don't know, maybe that's something that you guys might want to ask.
Okay.
Maybe she wants to go for the experience.
Okay.
Yeah.
I don't know how far she wants
Okay.
to go.
Sure.
Right?
We'll let her
So-
know all of our options.
Yeah. So, I mean, yeah, we can go either there or there, whatever. I wish I had done that in my operator part of my
Let's do it one more time.
I'm gonna do the surgery. I'm probably like, okay, I'm like, wait. I don't
All right, go ahead.
know anything about what I'm doing. But thank you. Oh, you're very welcome. It makes a big difference. It makes our life easier. Oh, but it helps. Oh, it's great.
I always take it for granted that
Okay.
everybody does this.
All of us sometimes, but. She has one part of it, and she's she should not be talking to her like that, but
No, we don't get it.
feeling she's gonna. Explain it. How many people we can knock on for this first show?
I look at you guys as energy and she'll be like, la, la, la. And we're all
I
like,
just don't want to be held responsible. If I her fires, I don't care. It's her problem.
do you happen to have
Our sign.
Okay.
Okay. And. Okay.
Ready? Hi. How are you? Wait 1 second. Oh, we shoot it in stages.
And. Okay.
Hi.
Good morning.
1 second.
All right.
Yeah, I do. Jakovich, Melinda.
Okay, go ahead.
Hi. Always hear greeting.
Hi.
Morning. Your last name?
Warner.
Oh, it's such a friendly atmosphere.
Your first name?
Val.
Okay. Miss Valerie, I'm going to have you to fill this out.
Okay.
And then registration will call your name.
Okay. Thank you so much.
You're welcome.
One.
Oh shoot. Want me to do it again?
Yeah.
Ready?
Go ahead.
Here we go. Oh God, I don't remember. 6th grade, 7th grade. No. No.
Yeah, because we called earlier this morning and their criteria is like 25 to 39. They're like cut off, so yeah. Okay, no problem. So Dr. Lauren Stryker is your ordering physician? Yes. Do you have additional doctors you'd like a report of your mammogram going to?
You can send it to Hobbs.
Oh, John Hobbs? Sure. Where are you? Oh, okay. I'm not sure what they are. Okay. Yeah, Dr. Hobbs. Any other doctors you'd like to know? Okay.
On the area where your imaging is going to be done.
Okay.
Wait 1 second.
Oh wait, we have to do it one more time.
Oh, sorry.
That's okay. You want to get her coming out of the door and,
No,
and
I
come?
just want to see you guys walking in.
Okay.
Yeah,
Go
let's
ahead.
get her coming out. Let's do that
At the
again.
door?
Yeah.
Okay, let's do it.
Here, I'll take the paper and then.
There you go. All right, and
Good morning.
Good morning.
Let me take your form from
Okay.
you, and then we'll go ahead and take you down to our imaging suite as soon as we can open the door.
Okay.
Sorry. We're just gonna walk on down the hallway.
Okay.
You can see we're broken down into suites. We're gonna go down to suite D, okay?
Okay.
How are you today?
I'm good, and you?
Thank you.
I get the Dogwood Suite.
So, we're all
What do all the different names?
There's cedar, there's
All
ash,
trees.
all trees, all
Okay.
natural.
Okay.
Now, after you get changed, you
Okay.
can have a seat in our waiting room right there. That's
Okay.
where Stephanie will call you from.
Okay.
There is a restroom there in case you need it.
Okay.
But our dressing room area is right in here, okay?
All right.
All right. You're gonna put your belongings in the locker.
Okay.
Hold on to the
Wanna go in
keypad.
Okay.
We're good. Nice warm gown for you.
Okay.
Now, in the dressing rooms, there are deodorant wipes in case you have deodorant on.
I didn't put any on.
And there's deodorant in case you need it for afterwards
Okay.
too, okay?
Okay, great.
So go ahead and have a seat after you get changed in that waiting room, and then Stephanie will be with you soon.
Did you say I
okay?
was 14, right?
Correct.
Okay.
okay, hold on a
me to do it
second.
again?
Like it's coming out. And go ahead. A little more. There you go.
So, Val, what are you doing now?
I'm curious. A little bit nervous. I just hear it's uncomfortable. It may be a little painful, so I have a high tolerance for pain, but this I've never been through before, so I'm not sure if I'll be able to make it or not. But thousands of women, millions of women do it all the time, so I'm sure I'll be okay.
So what is it that you're curious about?
I'm curious about just the whole process, the whole procedure. Of course, I want to know if there's anything there that I've missed. So, and I just think it's important to do. I'm getting to the age where, you know, I need to start doing this once a year, so I need to start somewhere.
Now are you nervous about this happening on TV?
No, because I'm such an open book anyway. I think everybody is used to me telling them any and everything about what's happening with me. So I feel like, you know what, I talk about everything else. I might as well share my very first experience getting a mammogram with everybody at home. I think she might be ready.
Yeah, I'm gonna cry. She's gonna come in.
My name is Stephanie. I'll take care of your test for you.
Okay, thanks, Stephanie.
Right this way. There's a chair just inside the door. You're welcome to have a seat.
Okay.
Come on in.
Okay.
Hold on 4 pink lines on here. If you would
Okay.
do the same for me, I'd
Okay.
appreciate it. Thank you.
Okay.
All right. No family history of breast cancer
No.
that you're aware of.
That I'm aware of now.
All right. And no surgery or procedures to either breast?
No.
Excellent. And no current problems or complaints. You're here because it's time.
It's time.
All right.
Getting close to 40.
There we go. All right. So as I'm getting everything set up here, there's a couple things we'll go over. No
Okay.
doubt you've heard lots of stories about this. So
Sure,
we'll
sure.
dispel
I've
the myths.
seen the pictures, I've watched the videos, yes.
There you go. We'll dispel some of the myths that are not true. We'll
Okay.
confirm the things you need to know. And
Okay.
then we'll go from there.
All right. What are some of those myths?
That it's incredibly painful.
Okay, so it's not
That
incredibly painful.
It's not.
Okay.
That the test could damage your breast tissue somehow.
Okay.
It's uncomfortable by definition, right?
Okay.
But it shouldn't be the worst thing you've ever done either,
Okay.
okay? The compression that makes this exam possible and worth having only lasts a couple of seconds per
Okay.
picture.
Okay.
Standard exam is 4 to 6 pictures depending on how things progress.
Okay.
Get this set up here. So everyone knows about the compression part, that's what everyone talks about, but there are 2 other things that I like to let people know about ahead of time.
Okay.
In addition to compressing the breast, I do need to try to pull the tissue away from the chest wall.
Okay.
So there'll be a little bit of tugging.
Okay.
People, if you're not prepared for it, it's a little weird.
Okay.
So the other thing is proximity, right? I'm going to be very, very close to you. At one point, I'll have my arm around you.
Okay.
And people that aren't ready for that are
Right.
taken aback.
What if you don't have big ones? Like, how can you?
It's a great question. We actually also do mammograms on men. So size is something that
Right. Shouldn't deter people because you're like,
no,
oh.
not at all, not
Okay.
at all, no.
Okay.
No, and the level of discomfort in this exam, of course, varies from person to person,
Okay.
but it shouldn't be painful.
Okay. All right. You ready?
All right, I'm ready if you are.
I am.
All right, I'm going to ask you to stand up for
Okay.
me. I'm going to ask you to untie your gown.
Okay.
You don't need to take it off. I just need it open.
Now, what do you want me to do with my mic at this point?
You just take cell phones out. I'm taking my off.
Okay.
That's fine. Okay. All right. You want to try this one? Yep. First thing I'm going to do is just look at the tissue around your breast, see if there's anything that we need to mark.
Okay.
Anything that's raised, moles, skin tags, etc., can show up on the mammogram. We want to make sure that the doctor knows that they're on your skin. All right. I'm going to put a shield around your waist. But it's cold and stretchy, so I'm going to have you hold right here, and I'll use the gown to guard your skin.
Oh, good. Yeah, you don't have to wear one of these, huh?
I don't, because I'll be going back here
Oh,
to take
okay.
the pictures.
All
And
right.
I'm actually going to change this, so I may have you step back just for a second. Thanks.
Ain't the little one.
No. We try to use it, so we want to use the smallest amount of equipment necessary. It gets the better pictures.
Right.
So.
But it depends on like what size you are, right?
Absolutely, absolutely. So there are people, I'm sure that you and I both know that this would never suffice.
Right. Right.
Alright. So as we go about getting started here, Your job is just to stand still
Okay.
and to try to relax.
Okay.
I'll keep saying the word relax, but I get it. It's a mammogram. So
Right.
I get to do all the work.
Okay.
And if you have questions along the way, or if something is just not working for you, or if you want to break, let me know.
Okay.
Stop, okay?
All right.
All right. One last time, can you verify your date of birth for me?
3/11/74.
Perfect. All right. Step right up. All right. Hands and arms stay by your side. I don't need to move you down for the first couple of pictures. Okay. All right.
Straight?
Yeah, sorta.
Okay.
We're gonna start straight.
Okay.
All right. You doing okay?
Yeah, I think so.
Oh, you're doing great. Okay. Come over to me just a little bit.
Okay.
As much as you can. Keep your arms and legs. You might want to turn just your face toward me. Okay. Ready? I'm gonna lift and pull. Okay?
Okay.
All right. Just making sure all the tissue away from the chest. Oh, this is that tugging carpet.
Okay.
It's a little weird. My arm around you as best you can. Keep the shoulder relaxed. Obviously, you're gonna feel this on your breast. You're gonna feel it in the top of your chest. You might feel it in your neck. Totally normal. It's all connected. Are you doing okay?
Yeah.
Alright, fine. Perfect. Right now, Valerie, take a small breath in and hold your breath. Don't breathe. Breathe and step back.
Okay.
Doing okay?
Yeah.
Not bad, right?
No, not too bad.
Alright. Nope. Uncomfortable, but
Yeah.
not painful.
No.
Tell us how it felt, Val.
It was just uncomfortable, but not painful.
Takes just a minute. Everything's digital, so as
Okay.
soon as the picture pops up here, I can make sure we have a good one, and we'll go on. All right.
I should have said when you asked me about doing this on TV, is just making sure nobody sees the boob.
That's
That's the only thing about doing this on TV. You're like, I don't want anybody to see my boob.
You're a brave lady.
Oh
All
my
right.
God,
Same thing on
right?
the other side now. Ready?
Okay.
Okay. So turn your hips just a little more. Come to me just a hair. Perfect. Ready? On this side. Actually, down by your side to start is better for me. I'll give you a place to hang on in just a moment. And again, release this arm down as much as you can. Perfect. All right. Take a small breath in. Hold your breath. Don't breathe. Breathe. Step back. Just like that, you're halfway done.
Oh,
Right?
oh, that's not
Ready? All right. I'm going to start moving this around. I will check my picture, make sure we're ready to go.
Okay. You're not seeing any boob, are you?
No.
No boob shots.
I'm actually going to go back to the other paddle for the side pictures.
Okay.
You're right on the edge of the two sizes, and I don't want to risk having a repeated picture.
Bigger size.
There you go. It's just to make sure I don't want to have to do this to you more than you need it done. All right, for this one, we'll take your left arm all the way out of the sleeve of the gown for me.
Okay.
Now that I have you tied up in there.
Right.
All right, for this one, I'm going to stand. Hips and feet are still a little bit straight. Excellent. I want this arm up above your head. Just as a reminder, no deodorant on right now, right?
Nope.
Excellent. Here we go. I'm going to have you follow me in. Relax this shoulder and hang on right there. Doing okay?
Mhm.
All right, I'm going to fuss with this shoulder a little bit. You ready?
Okay. Yeah.
Just kind of let me move you. All right, and again, I'm going to lift and tug and move. I just want you to kind of stay where you are. Try to stay relaxed. All right. My hand's going to come real close to your neck so you know it's coming to guard your collarbone. Take a small breath in for me. Blow it all the way out. Relax as best you can. Breathe normally. This one pulls on your shoulder. It's very close to your sternum. Right now, Val, take one more breath in. Hold your breath. Don't breathe. Breathe. Come on out. You Doing okay?
Yep.
That one pinches in a little different way,
Yeah.
right? You can step back.
Okay.
Make sure we got a good picture before I have you put your arm in. For the next picture, the machine will be reversed and she'll be facing that way.
Okay,
So I
you got it.
Yeah.
Just let me know when.
Sure. 3 down, 1 to go.
All right.
All right, we're gonna flip the machine.
Other arm.
Yes, ma'am. And take your right arm. Again, my arm's coming around. Just slowing it down.
Is it hard to do this for women with implants?
That's a great question. So it's different for women with implants. We do the same 4 pictures we're doing with you,
Yeah.
only we don't push very hard because of the implant. We then repeat the 4 pictures by pushing the implant out of the way and pulling the rest of the native breast tissue forward so we can image the native breast tissue. So they kind of get a double exam. All right, we go on.
Well, that's interesting. Did you know that? No. So if you have an implant, you have to like get a double exam.
You get 8 pictures instead of 4,
Oh.
or 8 to 10 instead of 4 to 6.
Is it more or less painful?
You know, I think you'd have to ask someone with implants, to be honest with you. Maybe before and after they had their implants put in. I think everybody has a different tolerance, and I think you find a wide range of comfort levels with everyone. One more time, and I'll take a small breath in. Blow it all the way out. Relax as much as you can. Breathe more. Breathe, breathe, breathe. One more breath in. Hold your breath. Don't breathe, don't move. Breathe. You can step back. Put your arm right there. I want to check this picture, make sure we have a good one.
Okay.
Actually, we're going to do that one more time. It's a little bit of your chin in the top.
Okay.
And although that's real high by your shoulder, that's where your lymph nodes live. So we need to be sure that we have a clear view there. All right. And I'm going to fuss with your shoulder one more time. There we go. So now by the end of the exam, you're very relaxed. You're a pro now. All right. Small breath in. Blow it all the way out. This is as much as you can. Excellent. Breathe normally. Chin up nice and tall. One more time, take in a small breath. Hold your breath. Don't breathe. Breathe. And again, make sure you're covered. So what happens next? My doctors are going to read the images,
Okay.
and they're going to send their report directly to Dr. Stryker. Once that report is released, we're going to mail you a letter. You'll get a letter no matter what from the Lynn Sage Breast Center with in layman's terms, the results of your own exam.
Okay.
All right. If the doctors want to see you back for anything,
I think she said they were going to look at it and tell me in 10 minutes. No?
yeah.
She need a little more charcoal. There you go. Okay.
All right.
Okay.
So is the whole experience what you expected?
You know what? It wasn't nearly as bad as what I anticipated.
Yeah,
it wasn't,
absolutely.
because I think the hype is that it's so painful. They're pulling your boob all over the place. They're smashing it flat like a pancake. And
That's
there is
right.
some of that,
Yeah.
but it lasts literally for 2 seconds, and it's not as intense as you may think.
Yeah, you're exactly right. And it is a different experience for every woman. I mean, there's no question that for some women it is really painful, particularly if they're small breasted, or some women if they have their mammogram right before their period, or they're big coffee drinkers. But even if it is really painful, it's not going to last. It's going to be quick. And you just, I would tell people, focus, maybe count to 10 while it's happening in your head. And before
And you don't
know
even make
you're
it to
done.
10.
No.
You may
no,
make it to
it's
1, 2,
quick.
or 3.
Yeah,
so.
it's quick. But the anticipation, like most things that are frightening.
Oh, yeah.
Plus, people they never think they have breast cancer until they go for their first mammogram, and then all of a sudden you're sitting there and you're looking around and you're thinking, oh my God.
What if?
What if?
It's
This
the
could
big
really
what
be.
if.
And it's the big what if, and it's very scary.
Right. And I think
What are you thinking now?
I think the biggest or the scariest thing is waiting for the results.
Yeah.
I think that might be scarier than actually having the
Right.
procedure done, because the procedure does not last as long as you might think. but it's the wait for
The
how long it
wait.
takes to read and get the results. Typically, for people, how long would it take for you to get
this
the
is the
results?
thing. Everyone, of course, wants the results right away, and it would be nice if they could get the results right away, but it's just not possible. And depending on where someone gets their mammogram, it may be as soon as 2 days, but it may be 2 or 3 weeks even. And the reason why you don't get your results right away is because the radiologist, who's the doctor who reads the results, during the day, they're generally doing things that demand their presence, whether it's a diagnostic mammogram, which is a more thorough exam for someone who might have a lump or breast cancer. They might be doing a biopsy. And when they're looking at these screening exams for low-risk women such as yourself, they need to be focused in a quiet room, be able to take their time. This is not something you want them to do on the fly. So with the number of women that are coming through and getting screened, there's just no way that a radiologist is going to be able to be there. It's not a quick look and then give the results. But it's hard. It is really hard. And then for about 10 to 12% of women, they don't even get their result. What they get is, you got to come back for another picture. And this is really torture because you get the phone call and you're expecting to hear everything is fine, or maybe it's not fine, and then you hear, you need to come back, we need another view. And it does happen about 10 to 12% of the time.
I've had a couple of girlfriends that's happened to.
And it's very hard. And the good news is that about 90% of women that go back for that additional view, everything is just fine. So what I tell my patients when they call up and they say, oh my God, they want me to come back, I can absolutely reassure them that more times than not, everything is going to be okay. It may be the picture wasn't as clear as they wanted it to be. It may be that they need to compare with another film. They might want to do another test, like an ultrasound, that's going to give them more information, different information. So do not panic if you get that, you got to come back.
Right. I learned something in there, and that is women who have breast implants have to get a double mammogram?
Right. They need a different view because the breast implant is generally placed behind the breast tissue, but the radiologist needs to get a good look at what's going on, not just in front of the implant, but behind the implant. And that's why when you schedule a mammogram, one of the questions that you will routinely get asked is, do you have implants? They're not just being nosy, they want to schedule a little extra time, and that way the technician knows that she's going to have to do these additional views. But a lot of people think with implants that they're not going to get a good look. They do get a good look, and they are able to find early breast cancers. They just need to do these additional studies.
Got it.
Val, ask Lauren when you should start getting them and how often.
Okay, sure. Okay, so I am 39 and a half.
Yeah.
And I know some women who start getting mammograms, let me start again. I am 39 and a half, and I know some women who start getting mammograms as early as their 30s, but typically is 40 when you should start getting your mammogram?
That's such a good question, and it's a confusing question because different organizations are giving different recommendations. Right now, essentially everyone agrees that women over the age of 50 should get a mammogram every 1 to 2 years. The area of controversy is in that under 50 woman. Now, the woman under 50 who absolutely should be getting a mammogram is someone who's high risk, someone who either has a genetic mutation that puts them at increased risk for breast cancer or who has a strong family history. They do need to start mammography early. But for a low-risk woman, there's a lot of controversy about, is it a good idea to get a mammogram from 40 to 50 or not such a good idea? And the concern, of course, is that, first of all, the breasts are dense. It might be harder to read it, so you're going to miss something anyway. And there might be unnecessary biopsies in a group that's generally low risk. So it is a very individual thing. And really, when my patient asks for my advice, I look at her family history, I look at how easy it is to examine her breasts, I look at the whole picture, and then her comfort level. Say, do you worry about this? Is this something that you want to do? And right now, most doctors are still recommending an annual mammogram between 40 to 50, but a lot of the organizations are saying, maybe not necessary.
So what about that woman in her 30s who thinks that she should get a mammogram? Maybe she doesn't even have family history, but she's just, precautious or nervous or,
one of the things that, of course, physicians have always told their patients is that they should do a monthly self-breast exam. And this also is somewhat controversial because what we are learning is that's not necessarily the way to detect early breast cancer. And in fact, most breast cancers are detected by mammography. If you look at women over 50, 90% of breast cancers are detected early on mammography, and in the under 50 crowd, 75%. But what is important at any age is to have what I call breast awareness. Even if you're not doing a formal breast exam every month, if you have something new, you know, a lump, a bump, a tender area, nipple discharge, something that's not going away, don't ignore it no matter what your age. More times than not, it's going to be fine, but sometimes it is an indication of something serious.
Is there a particular time of the month you should do your self-breast exam?
Yeah, ideally you want to do it after a menstrual period. And the reason why is that before your period is when breasts tend to be the most tender, and sometimes you will get some of these little cystic areas that come and go. And if something goes away after a period, you don't need to worry about it. So in fact, if a woman calls and says, I feel a little something in my breasts and I'm concerned, the first question I'll say is, when is your period due? And if she says tomorrow, I'll say, try and keep your hands off, as hard as it is, because of course when someone feels something, it's like they're constant, they can't stop. And I'll say, try and keep your hands off of it, and if it is persistent after your period, come on in and we'll check it out.
Got it. Good.